this is going to be posted to the CT Boss website after the presentation this afternoon. The slides are already posted to the CT Boss website, and I put in the chat box where to find that. You just need to go to the COVID-19 page, and it's under COC specific COVID-19 guidance, and then outreach and path. And you can find all the materials for today. As Andrea said, there's a lot of materials. We're going to go through some of it rather quickly. So please feel free to reference those slides when you need to. Lauren, is the present? I don't see the presentation up, the slides up. There we go. Great. Here's our agenda. So we were going through welcome and introductions. The first thing we're going to do is the key findings and outreach survey. As Andrea said, thank you so much for your time and filling out that survey. It really helps us to see where you all are and what the needs might be out there. We're going to go through some best practices and resources from national partners that we've gathered together. Then Andrea will do the facilitated discussion. There are a bunch of resources and next steps in the additional slides, and then Brenda's going to give you updates from DMIS. Next slide. All right, so up to date, we received a few additional responses yesterday. We received 13 responses altogether from the outreach survey that we put out there. 5 respondents were outreach workers, 6 supervisors, and 2 administrators. And what you all responded was that 2 respondents increased the frequency of outreach. 4 remained the same in terms of reaching out, doing outreach out of doors and indoors. 6 respondents said they had decreased the frequency of outreach, and 1 provider said they eliminated outreach altogether at this time. And then we looked at availability of supplies.
When are you going to put it out?
Oh, I didn't put it out. I should put it out. Yeah.
I just want to remind people to mute yourselves if you're not speaking right now. I heard a little bit of background noise. So we looked at availability of supplies, and most projects have some or adequate masks, gloves, hand soap, and trash bags. But we did find that 25 to 30% had no eye protection, hand sanitizer, soap, cleaning supplies, garbage bags, or paper towels. So there still are people looking for supplies out there. Next slide. And the focus areas that were reported for people, 9 of the 13 respondents said they're helping people to safe distance, and that's safe distance for unsheltered persons, and then help their clients find safe distance shelters where there's enough room for everybody to sleep 6 feet apart from one another. 9 respondents are helping people move into housing, continuing that focus area. 9 are focused on meeting basic needs, so food, shelter, money, help, and access to care when they're sick. And then 10 respondents said they're helping people helping move the most vulnerable people to hotels, motels, and shelters when those resources are available. 85% of the respondents said they are screening during every encounter, and that's remote encounter or in-person encounter. And 3 respondents, or 24%, are giving every client with a cough a mask. 1 provider is not doing either of those things. Excuse me, 85% of the respondents have identified the most vulnerable of their clients and are making a strategy where they're checking in with those people most frequently. And hopefully you're all able to use those outreach plans that you put together earlier this year to help do that work, to help identify the most vulnerable people in your client load. And 77% of respondents said supervisors are checking in daily with their staff to check on stress levels, to check on resource levels, help with anxiety, help with management of what they're seeing out there on the street. 54% of respondents said they are working with their local public health authorities to really create a community response to this pandemic. Next slide. Risk reduction strategies that you all reported you are using include 60% or more people said that they're using in-person outreach only as necessary to ensure safety and expedite housing. They are maintaining 6-foot distance between staff and clients, and then giving education to those clients about the 6-foot distance and how to use that when applicable. 60% are wearing cloth or surgical masks, working from home when not conducting in-person outreach. And 60% said staff are instructed to stay home when they're symptomatic or they're in close contact with people who are symptomatic, suspected to have COVID-19, or are already determined to be COVID plus, as they're saying. Staff are also instructed to discontinue interaction if they're unable to protect themselves or their clients, and then go and report back to their supervisor how that interaction went to troubleshoot any strategies to deal with that in the future. Next slide. And yes, the next few slides will be some best practices and updates from national partners. So, to state the obvious, COVID-19 among people experiencing homelessness, the people that we're serving as people experiencing unsheltered homelessness are some of the people among the highest risk. The rate of infection is really unknown, but a recent paper assumed that 40% of people experiencing unsheltered homelessness are COVID positive. Infected homeless individuals, as you know, have a high degree of chronic physical health conditions. They're twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die, unfortunately, of COVID-19. Testing at a Boston shelter showed that 37% of the people in that shelter were infected, and all were asymptomatic. So we can't tell just from some even self-reported symptoms or symptoms that we see if people are infected, which is why some of these safety practices that we're going to go through are so important to be using. And which is all of this to say, to echo Andrea before, is why outreach workers rock. The work that you do with outreach is so critically important. So to continue on that, there's a lack of accurate information. There's a lack of accurate information in the general public, and even more so in people experiencing homelessness. So it's our job as outreach workers to provide that education to our clients, to tell them how to protect themselves, to tell them how the virus is transmitted and how it's not transmitted. It's our job, when possible, to talk about social distancing, to be able to give them, if we have available hygiene supplies and access to essentials like food, clean water, that type of thing. As I said earlier, alluded to earlier, our clients have a high degree of vulnerability, even more so now than in normal times. So as much as we can, we need to monitor symptoms, do assessments at every encounter that we can, and do frequent check-ins to check on our people who we know are highly vulnerable. The safest option, so this is where all of what we heard about housing as healthcare is really coming into focus right now. When you are housed, you have better outcomes for physical health, mental health, behavioral health. Housing just helps us to be able to care for ourselves and one another in a better way. So we need to continue focus on housing and use the resources of hotels and motels to keep that distance as much as possible at this time. Next slide. Harm reduction. So on the harm reduction is important during normal times, and with the increased stress of COVID-19, the increased general anxiety, there's increased risk of substance use And then there's increased risks having to do with withdrawal as well. So people are having difficulty now accessing alcohol, drug supplies, and then when they do access alcohol, drug supplies, they're putting themselves and others at increased risk because they may be doing so in an unsafe way, whether they're using masks or not, interacting with more people. And then if they aren't getting supplies, of course, there's heightened withdrawal and overdose risks. Some drugs of choice that people use worsen breathing problems. And then, of course, sharing and obtaining drugs increases the risk of COVID-19. Next slide. So here is some COVID, there are a lot of harm reduction, good best practices going on out there and good resources out there. These are just a few that we put together that are excellent to look at. They're on our website and then they're here for you as well. Next slide. That's Lauren.
Hey everybody, I'm Lauren Preddy from Housing Innovations, and I just wanted to echo what everyone else has said already about how incredibly impressed and appreciative I am of all of the amazing work that your outreach teams are doing. When we saw, despite these incredibly rough times, when we saw the results from those surveys, it was very clear to us that you guys are on this and out there and, doing as much as you possibly can to help keep your folks safe. So really just from the bottom of our hearts, thank you for all of that. So, as Andrea said in the beginning, right, these are really scary times, and safety for our staff and our clients really has to be our top priority. We know that when we're afraid, all of us, right, it's scary for everyone. It's harder for folks to be able to do their jobs, right? The anxiety goes way up, uncertainty goes way up, rumors are flying around, and it really can be, the fear really makes it harder for folks to engage as a team in creative problem solving. So to reduce that fear, we really have to focus on helping people to feel safe and helping people to plan. So like I said, based on the survey results that we got, you guys are already doing most of the things that are on these slides, so kudos to you guys. We're certainly not going to go through all of this information. There's just a couple things that I'm gonna mention. So we know that coronavirus is less transmittable outdoors and in well-ventilated spaces. So we want to make sure that you're communicating that both to your clients and to your staff, right? The risks of transmitting coronavirus are actually much lower if you are working with people and maintaining all of the safety protocols outside, right? It's much lower than working with people inside. The other thing that I think can really help folks is knowing that there's a plan in place, right? Knowing that there's a plan and that each individual worker is not alone and responsible for executing that plan is really reassuring for folks. So even if you don't have any clients who are currently sick, you really want to make sure that you've established a protocol for what you're going to do if someone gets sick, whether that be a staff person that gets sick or a client that gets sick. And then making those safety plans with clients so both the staff and the client know what to do if they start to feel sick. And again, that kind of planning is incredibly important and reassuring to people in this kind of crisis. So we obviously know, and Shannon went through some of the survey results on this earlier, that getting that protective personal equipment or PPE is a challenge everywhere. We've got some links to this slide on how to use PPE if you can get it. And we've got links to some training videos here as well on how to use PPE. The good news is that most of you reported you have either an adequate or at least some supply of the most critical things like masks, but there were in a couple of geographic areas in the survey that you reported that your folks don't have access to masks. So outreach workers are absolutely critical frontline staff in managing this public health crisis. And so we want to make sure that if you don't have enough PPE, especially masks, that you definitely make sure that you're coordinating and communicating that with your local public health authority and your local emergency management authority. So those are the folks that really should be managing the local response to this, and hopefully can be helpful in finding creative ways to get that PPE. If you can't get the surgical masks, or you've decided that because in your community there's a shortage of those masks for the critical frontline healthcare workers in hospitals, you're opting not to use those masks and you maybe donate them if you have them in the hospitals, which is understandable. If that's the place that you find yourself in, you definitely want to make sure that to the extent that staff are out there having face-to-face contact with clients, or clients are having face-to-face contact with each other, that you make some cloth masks. And there are guidelines on the CDC website about how to do that. We also know from the survey that some of you guys are transporting clients, and because a car obviously is a small confined space, that heightens the risk of transmission. So there are some guidelines here on this slide about what kind of adaptations you should make for vehicles and protocols and training for any staff that are doing that kind of transport. So I wanted to make sure that you had that information. Okay. So these are extraordinary times, right? And I think in this kind of crisis, it can be tempting sometimes to relax some of the standards that we were using before. And when it comes to safety, we just want to make sure that those standards are heightened and not relaxed, right? So all of the things that were important for you to do before in terms of staff safety remain important, right? You want to make sure that staff, you always know where outreach staff are at all times, right? That you're keeping in touch with them, that you know where they are and when they're coming back. You want to make sure that whenever possible, folks are outreaching in pairs, and that if it's not possible to outreach in pairs, people are not going to places that are remote and not publicly visible by themselves. So all of those usual things that you guys are already doing. And then, having a team as much as possible is really super important always, but particularly during a crisis. And we know some of you have one sole outreach worker, and so just really trying whenever possible to connect that worker to maybe another team that exists at your agency so that they can have a home base of folks who they are regularly collaborating with, problem solving with, and getting support from. It's also, if possible, to try and cross-train. So you're training some folks who might normally work in a different program on how to do outreach, and you're maybe training outreach workers on how to work in a different program. And that really allows, that kind of cross-training really allows a couple of different things. Number one, it allows you, if you've got outreach workers who themselves personally are in a high-risk group, they're elderly, they've got some underlying medical conditions, it allows you to reassign them and maybe assign someone else to do face-to-face outreach to reduce their potential exposure. It can also help to ensure that in case the outreach worker has to be out, right, we absolutely do not want anybody who's sick coming to work, so that in case the outreach worker has had exposure or is sick, that someone else can cover the job because they've been cross-trained and maybe been out before with the outreach worker. And then again, it really just allows people to have that sense of shared responsibility and team being able to problem solve together and really take care of each other. And that is more important than ever right now. We know, obviously, Shannon talked quite a bit about this already, that folks living in unsheltered locations are always at high risk for all sorts of dangers, and that's more true now more than ever. And so we did a quick scan of available guidance and pulled together the next few slides on how outreach teams are helping their clients to reduce those risks. Many of you are already doing these things, and again, we're going to post these slides, so I'm not going to go through each of these things, but just mention a few things quickly. A lot of you reported that your clients don't consistently have access to means to wash their hands. And so on this slide, there's a link to some instructions for how to make a very simple DIY hand washing station using, supplies that you can get at the grocery store or Costco. So that there's a link here. There's a link here to that. The other thing that we wanted to just say quickly is that the more we can help clients to get the things that they need, right, the less they're going to be out and about in the community and, exposing themselves and potentially exposing others. Obviously, you're not going to be helping your clients to get the dresses that they need and want. So for anybody that's got an active addiction, there's some level at which they are going to be out and about. And then, what you really need to do is be educating them about how to do that as safely as possible. But in terms of other kinds of things that people might be out and about trying to procure, this slide just has some examples of types of things that outreach teams are often trying as much as they can to regularly provide to their clients to limit the amount that they're out and about. The other thing that's really important is, and I think a lot of you guys are doing this already, is that you really, if you can provide a service as effectively by phone as you can face-to-face, or nearly as effectively, then you should do that, right, to limit the amount of face-to-face contact. And so in order to do that, you obviously have to have contact information for all of your clients that have phones, and you want to make sure that that information is documented in a shared system so that if the outreach worker has to be out, someone else at your agency can pick up where they left off with their clients. This slide has some information about phone resources to help people get cell phones and to get minutes if that's an issue. And then this is a sample protocol from the state of California. As you know, DEMAS and DOH have been working with outreach providers on identifying vulnerable, unsheltered people who are willing to go to a hotel. DEMAS has secured, DOH and DEMAS together have secured hotels through some of the emergency ESG CARES money, and they are asking outreach providers to identify vulnerable, unsheltered folks who are willing to use those resources. So the link here is for this protocol that comes from California, and we're just showing this as an example. Obviously, you should follow whatever protocol your CAN has put in place. We're just sharing this in case it's helpful to your CAN. And as you can see, what it really covers is where people should go if they are being discharged from medical care, and then what to do based upon the symptom screening that you're doing with your clients, right? Who should get prioritized for hotel placement and who should remain in their current location. There is a link at the bottom of this screen to the DOH screener and triage sample protocol. And so if you haven't checked that out, if you're not using that, you definitely want to check that out. And you want to make sure for sure that when you're screening people for symptoms, so do they have a cough? Do they have a fever? Are they short of breath, right? Have they had an exposure? That whatever you're finding, that you are communicating that with your local public health authority. Because again, if there is an outbreak of COVID among people who are unsheltered, that is absolutely something your local public health authority should know and should hopefully be helping to mobilize some medical resources to help you guys manage that kind of situation. All right. So this slide lists the severe symptoms of COVID-19. I'm not going to go through them, but obviously if you are encountering people that have these severe symptoms, you want to make sure that you call 911 or otherwise arrange for that person to get immediate medical care, and you want to make sure that you call ahead if someone is going to their doctor to let them know that you think they might be positive. And then this is really just a summary of, the bottom line in any symptom screening protocol. So If someone is not a member of a high-risk group and has access to hand washing and the hygiene that they need, and they're sleeping in a place that's, you know, at least 6 feet apart from other people, then you are going to encourage them probably to shelter in place. That's probably the safest thing for them, or maybe to go to a congregate shelter that has adequate, you know, distancing. I think that's kind of choice about how they want to manage their own risks. You want to educate them about what their options are. If they are high risk, obviously the first thing you want to do is try to prioritize those people for housing as quickly as possible, as Shannon talked about. That is going to be more difficult now than it ever was. So for that high risk group, those are really the people that you want to think about sending to the hotels that DOH and DMIS have identified. And then finally, obviously, if someone's got serious symptoms, you want to try to help them access immediate care. All right, and hopefully that this screening and triaging protocol is happening through your PANs. I am now going to turn it over to Andrea, and I think we're going to open up the line, or we're going to have people unmute themselves if they want to speak, I think is what we're going to do, rather than opening up the line for everyone. All right, Andrea.
Thanks, Lauren. Thanks, Shannon. That was a lot of information. People did get links people have asked for links in the chat box. This will absolutely be posted online at the BOSS website, and Shannon put that up. There are also a range of resources on the BOSS Rep website, and everything that is in here is also there. It's been really helpful. So I just want people to know that that's there. So let's start a little bit about this crisis has been long, right? It's hard to be in crisis for a long time, and that it affects both all of us, but also the people we serve. So we're going to start a little bit with sort of meeting basic needs. And part of the basic needs in a crisis are the PPEs, but it's also the things that Lauren mentioned, making sure that you can get 911 or an ambulance into an encampment if somebody needs it. How are you going to manage that? How are you going to get people into hotels if they need to self-isolate? How are we going to get people masks and stuff like that? And I know that some people are having trouble getting masks, and I know that some of you all have gotten them, as well as hand washing places and places to disinfect, maybe even gloves for people. Talk a little bit about how you get basic protective stuff for yourselves and also the people that we serve. Because one of the things that we know is that both people have a mask, even a cloth mask, it significantly decreases risk, and it decreases risk for that person. So how are we going to do that? Are there some people who have been able to get that basic equipment, and how did you do that? Don't all talk at once. Is there anybody out there who feels like they have some basic equipment? No? Yeah? David, just unmute yourself. It's at the bottom right of your screen. Yes? No? If you hover your mouse at the bottom of the screen, believe me, I am not a computer maven. Yeah, go ahead.
It looks like somebody unmuted me. I think maybe you were just hearing my toddler shout in the background. I wasn't trying to talk.
Yeah, that's the other thing is lucky when you're at home, you're completely relaxed and you have nothing to do, right?
Yeah, that's right. I've got a 4-year-old who's really missing his buddies and his school and his social outings and his restaurants. He is not a homebody.
I bet. I feel his pain.
Yeah.
I feel yours too, because I've been playing with a lot of Legos.
Absolutely.
Sorry.
How are you managing, David? How you getting that? How you getting the equipment? How are you talking to people?
What time is it on?
No?
There. Thank you for muting me.
Okay.
I don't like being silenced.
Okay.
This is David, Homeless Hospitality Center.
Great.
So everything you said, we've been reducing our visits. Most of our outdoor people have phones. The don't. That's challenging. And early on, we provided some basic hygiene equipment.
Great.
And also, Homeless Hospitality Center in the city has set up an isolation center. So that's it hasn't been heavily used yet. So I think we're pretty well equipped. But you're reminding me of some things we have to catch up on, because here in Eastern Connecticut, we're expecting the peak. The peak is expected in the next 2 weeks.
Yeah.
I'm going to sort of redouble my efforts, supplied, and make sure they're protected. I do find, and others may know this as well, I mean, our clients, they're kind of fatalistic, and that makes it kind of hard. It's like, well, whatever happens, happens.
Yeah.
So, you know, I'm trying to address that and do what we can. We've got 1 or 2 people on track for housing, but of course, that's always a challenge. So thankfully, nothing, no serious urgencies, but I'm glad to hear from you, because I think I really want to redouble our efforts now, because it's going to get, you know, we're expecting it to get worse. So that's kind of where I'm at.
That's great. And you're getting supplies from the city, and the city is working together with you. The department.
I'm not the direct contact with the city. I'd say we're still struggling with supplies. Yeah. One thing I'll mention, and this was touched on too early on, 2 or 3 weeks ago, we put signs, postings, laminated signs out on all the sites about protecting, and gave everybody the hotline number. I don't know if that did any good, but it certainly made people aware.
I want to talk about that for a minute. Is, you know, when I used to work outreach, one of the things that the people I served used to tell me all the time is they felt invisible. And they felt like they were the last priority. And that you guys are the ones that are telling the most vulnerable people we serve that they're your priority. And that's a really important thing. And I don't want anybody to underestimate that. I also don't want, yes, masks are important and hand washing places are important, and we want to make sure that people have that. But just having the contact with you is really important. And also making sure that people have some of the basic needs met, so that maybe there's food in the encampment, or there's food that they can take with them, and that they don't have to go out every time, and that we're talking to them about how they're getting their methadone and how they're controlling that, and how their phone is got extended minutes, and giving people the numbers and giving people some of the education is really important. And yeah, people are fatalistic. You know, the thing that I have to relate to this is after 9/11, we were really worried about the people we served, and it happened to be in permanent supportive housing, and we would talk to them all the time. And finally, one of the clients came upstairs and said, look, you know what? You need to relax. We're used to this. We're used to being in crisis all the time. We can control this. And you know what? We had to talk about, yeah, but we're there to help, and we can make things better. And that we can help work together with them to make things better. And I think that that's part of the message that we give our clients every time we contact them. And that's really important. But I also know for the staff, it's really hard for them. It's frustrating. I mean, we're hearing from people in outreach, people are still doing things like panhandling. And you know what? It's scary. And when we get scared, we say things to people. But you know what? We say things like, you know, let's talk about, you know, let's talk about this. And I'm worried about you. Giving people that message is really good. Also, go ahead. Who's going to talk? I certainly don't want to be talking the whole time, y'all. Please, feel free.
I know I keep having, as David mentioned, I keep having my mic off. Just it's a pretty small apartment. I got 3 kids asking lots of questions about their schoolwork. But to speak to what David is speaking on, you, Sharon, as well, Lauren, even earlier than that, just being protected right out there. I do think my company, which is CHD, has done a pretty good job of supplying me with the gloves, masks,
Okay.
some
Good.
sanitizer. I recently met some providers out in Winstead, one of which was the volunteer rover. She was able to give me some small packets of hand sanitizer. So when I am doing my outreach on Monday afternoons and Friday afternoons, dropping off food at the campsites such as Thomaston Ave, and there's another encampment on South Main over here in Waterbury,
Yep.
or some encampments in Torrington and Winstead, because I cover the northwestern corner of Litchfield County and as well as Waterbury. I've got food going into the campsites. I've got gloves. I've got masks, both medical masks and cloth ones.
Great.
I was told by some of the providers at the church that Litchfield Distillery
Yep.
is the first responders is handing out, is creating their own alcohol, more or less, specifically for sanitation.
Fabulous.
So if you email them, they should be able to provide you with some free sanitizer for you and the people you're servicing. So I do think I am prepared in that way, and it has been very interesting, the responses of a lot of my specific clients that I have their numbers on my charts, that they're just as concerned about me and asking me to say, hey, don't come out, we're taken care of, like, we got it, you dropped the food off, you gave me the wipes, big dropping off hygiene products so they don't have to necessarily leave as often.
Yep.
Deodorant, snacks. They're just as worried about me staying safe as I am about them being safe, knowing that they don't have the luxury of having access to everything that I have. So when I go out, bringing them as much as possible in the safest manner possible, and then just staying in contact at least once a week. I try my best twice a week to contact my entire client chart and see what their needs are. So next time I'm on, I'm able to provide it.
That's great. That's really helpful. That's a really good resource. Is a lot of sort of distilleries are making hand wash soap. So to know that, so could you put that in the chat box about if they're going to email them, if there's an email that they can send?
Yes. I'll look for the link right now.
Thank you so much.
No problem.
Thanks, Nico.
No problem. Thank you.
Anybody else?
Hi, yes, good morning. It's Shakira from the Waterbury Hospitality Center. I do not have a video on because I'm currently 7 months pregnant, and I do not want to alarm anyone on how I'm looking right now, so I'm going to say
I can relate.
a video. However, I'm Nico's supervisor, and I run a hospitality center out here in Waterbury. And I would say my biggest concern is, just like you guys mentioned, our guys don't really understand the urgency and the importance of what is going on. You know, we're calling them almost every day, checking in, hey, how are you? And they're like, would you just calm down, relax? So it kind of feels like the reversal of the role. Like we are feeling like it's our job to protect them, but they are really stepping up and protecting us in the sense of assuring us that they're okay. So I would say that that's definitely been what I would take away moving forward, is just how it's a relationship. It's our relationships that are important, because it's really a community effort. It's not just about us being there for them 100%. I think they are feeling the burden of being able to be there for us now as well. But I think I've also noticed that the people that we are working with, they don't really want to tell us the truth as far as their symptoms. And even if they are positive for COVID-19, because they're fearful of being quarantined. So I'm overseeing a staff that is working in a hotel here in Waterbury, and they have a hard time being isolated and staying in one area. So it's been a lot of instances where we have to redirect them to go back to their room. They're refusing, leaving the hotel, putting more people at risk. And that brings upon other issues with legal issues, because now you have to call the police. So it's just kind of them not understanding the severity of what's going on and trying to protect them and other people at the same time.
It's a really
So
interesting.
I just, Andrea, really quick, one resource on that. So if folks didn't see it, and we'll get this link in the chat box in a minute, but Healthcare for the Homeless is doing a webinar, I believe tomorrow. The National Healthcare for the Homeless is doing a webinar, I believe tomorrow, on strategies for working with folks that are not, that are having trouble following the isolation guidelines to avoid, hopefully whenever possible, any legal intervention to make sure that folks are not putting other folks at risk. So we'll put that link in the chat box in a minute.
You know what else though? I think that one of the things
Thank you so much.
then that's really helpful. I think Shakira, you mentioned that people are concerned about us. That's okay. That's a really good thing. And we want to talk about that. People, especially people who are homeless, I'm always amazed by how generous they are and how willing people are, not everybody, but you know, how willing they are to help other people. I think that one of the ways to get people to comply with some of the things about COVID is to talk to them about helping other people. Wearing a mask helps me. It helps me because we use a simple diagram about infection, and if both people are wearing a mask, the risk is very low, especially outside. It's infinitesimal, and I think that these are something that we really want to talk to people about helping them feel that generosity. The other thing is, I'm glad to hear you have access to hotels, and everybody should have access through the CAN. But one of the things that we're finding across the country is people really need some services in those hotels to help them follow the rules, right? It's not like in a crisis that, think about your people who you moved into housing before. They probably had a lot of the same issues. They were lonely, right? And that one of the things that we want to talk to people about is making sure that things happen. So this is going to sound silly, but a really good intervention one of the buildings in New York did in a hotel is they got everybody masks. They all sat in their hotel door. The staff in the hallway called out a bingo game. They could relate to each other, and the prizes were money. They were small gift cards, but it really motivated people, and helping people do that. The other thing that was really helpful is to get them working on small projects. You know what? Now might be a good opportunity to, let's send away for your birth certificate, or let's try some of these things. It makes people feel confident. So making time to do some of that that's going to help them later in housing is really important. The other thing is we want to make sure that people understand what their options are. And, you know, people hear things. There's a lot of jailhouse lawyers out there. You guys have some of that experience where people tell people, oh yeah, in this hotel, oh yeah, it's got barbed wire around it and the police patrol the perimeter. No, that's really not what hotels look like. But you know what? Hotels aren't the only option. So let's talk about what the advantage of a hotel is, and let's talk about what the disadvantages are. And can we increase the advantages? One of the things is you have your own bathroom, right? You could take a shower, those sorts of things. People aren't going to stop you from going out, but tell me, you know, but it does put you at risk. So let's talk about the reasons for going out. And then dealing with some of those harm reduction things, because look, I smoked for 40 years. Somebody told me I couldn't go out for cigarettes, I would be out of there so fast. We know these things, right? We also know that a lot of people, not everybody lives in encampments, not everybody lives around other people, but a lot of the people we work with do. And it's really hard for them. So creating opportunities to socialize, but keeping a safe distance is really important. You guys have all this information because you know what people usually do during a normal day. So really reflecting their roles and in terms of the expectations. It's not that different from what we do in housing, right? You can only have people who live there or on the lease live in housing. Okay, so let's talk about this. You've lived around other people all your lives. Is it possible that maybe you go to a hotel with some of your friends, and you can socialize this way, or I probably wouldn't say socialize, you can talk to them this way, right? So having that information is really important. Alice, do you want to say something? Sorry.
I think Alice did, and then Ron
Andrea,
Speed also did.
I'm sorry, I think Alice accidentally clicked the raise hand button, so no, Alice is all.
But I see Ron Speed's hand up also.
So
And he's unmuted, I think.
yeah,
yeah.
I just wanted to talk a little bit about hotel trade-offs. As you know, we have both a shelter and obviously outreach people as well. We're prioritizing the congregate setting in the shelter over outreach people for hotel space. I know Department of Housing is providing funding for that. I just want to check if that sounds right to you. In my sense is that people outside are less at risk for this than they are in the congregate setting, and so it's appropriate to prioritize the shelter. So we did do 100% check of all our outreach people to make sure that anybody over 60 was in a hotel. We didn't have anybody at that level. So I think we've taken care of the elderly for those of us that are 60 or over. Just wanted to put that out there and see if you had any thoughts about it.
Yeah, there's a couple of, for one thing, it was a kick in the pants when I started getting all these emails and I realized that people considered me elderly. That was horrifying. So I totally relate to that. I think that looking at priorities in terms of wide swaths of who's the priority, I think that depopulating the shelters and making it possible that people keep a safe distance from each other, which is hard in a shelter, is a really good idea. I think that there's going to be some cases where everybody's dependent on you guys. You know who's at risk, right? So thinking about that. The other thing is we have to think about comfort and we have to think about other things. I mean, sleeping outside would be tough if you're sick. So somebody may not be need to go to a hospital, but they may need a hotel room. And I think making sure that you work with your CAN to prioritize those people is a good idea. Lauren, do you want to say something?
Yeah, I was going to say, I think if someone is symptomatic and outside, then that's a person that might get prioritized over someone in a shelter who, for someone in a shelter. So obviously, all of these decisions are very nuanced and case by case, and hopefully there are conversations happening at the CAN. But if you're seeing people who are, are exhibiting symptoms of COVID that are unsheltered, particularly if they're not practicing social distancing, right? Those are going to be good candidates to prioritize for hotel placement.
Yeah.
In our case, we've got a isolation center there in New London. So, and outreach people are expected to go there if they're symptomatic. And
you know what? Sometimes
even better
congregate setting where people can be around other people, but also, can safe distance is a better option for people who are used to living with a lot of people, because you want people to be able to stay inside. And we've got to look for things that have comforted them or they've made decisions around in the past. I'm going to wrap up this because we want to hear about the PATH resources, but I want to offer this that at this point, we're scheduled every 2 weeks. We can do a combination. But I think it's really helpful if people hear from each other. The other thing is that we can talk a little bit about teaming. We can talk a little bit about getting support. I know that self-care is going to be part of this. This is really frustrating and sad work. Can also be joyful, but in the middle of a crisis, the moments of being joyful are separated. And that one of the things that we want to do is make sure that you guys are taking care of yourselves. So we're thinking about that in future meetings. And also that, you feel like you have the resources. The reason we started with resources is because in order to be effective at our job, we've got to have the resources we need. And that was part of the discussion today. I thank you, everybody who participated. I thank you for the work you do every day. I think that making people not feel alone and helping people feel options is the best work you can ever do. And we just want to say how much we appreciate it. And with that, I'm going to turn it over to Brenda.
Did you want to just hit these last couple slides before me, Lauren or Shannon?
I just want to maybe, go ahead. No time, Lauren? Okay, no time.
I think at least
Brenda.
to show the one about, if you could at least show the one with how to get their stimulus, because I think that's an important one.
Oh, yeah.
Okay, yes, you've all heard about the economic stimulus impact payment that's out there. So there is a link here for people who do not file taxes to enter payment information. So if you don't file taxes, like there's no reason for the IRS to have your, well, for some people, if they don't have your bank information, if you don't already receive direct deposit, this would be a way to click on that link to get your payment more quickly. So eligible US people are US citizens or permanent residents. Who should use this link? Sorry. Eligible US citizens or permanent residents who had 2019 gross income that didn't exceed $12,200 or $24,400 for married couples, or who were not required to file a federal income tax return for 2019 and didn't plan to. So please use that link, and use that link to see all the information about, if you have any questions about this IRS payment and how your clients can access it, go ahead and go there.
All right, great.
Please also know that there are other resources on the BOSS website about things like unemployment, and also things for people who may be undocumented immigrants. So they're not a lot, but there's some, so that might help.
Great. I could probably do these updates in the next couple of minutes so we can wrap up on time. Just to kind of continue the conversation that we've been talking about, making sure everybody's working with their CAN around unsheltered, and if people want to, moving them into hotels. Please, if you haven't already, if you could respond to my email that I had sent yesterday. I'm trying to gather some information on what each of you are doing. CMS is working really closely with DOH and CCEH to really try to respond to the needs of the unsheltered homeless. So if you can just respond to my email, kind of let me know what you're doing as far as the CAN. If you have any elderly or medically complex clients that are living outside, if you can send me that information. Also, I know CCEH has quite a bit of diversion money. I believe that's from DOH, and it has to be spent by the end of the fiscal year, which is June 30th. So if you want more information on that or how to access that, certainly shoot me an email. You can certainly house people right from being unsheltered. I think it's a $2,500 max for financial assistance, and they would also get a security deposit guarantee. Any questions about that? Okay. Just to kind of continue with your outreach plans, I know those were a new thing. Those were due in March, which I don't know, maybe it was a blessing that we got those done. So you kind of continue to revisit those as far as who your most vulnerable clients are to ensure that you're reaching out to them. It sounds like most of you are either out still canvassing, meeting with encampments and clients in encampments, or you're taking the time during the week to at least call them and touch base with them. So that's fantastic if you can keep that up. For those who are PATH providers, you've been getting emails from me because SAMHSA still wants us to finish the PATH application that's due mid-May. So I did send out information to each of you. I need an updated intended use plan and an updated budget with details of your match. I need that by April 29th, because then I have to turn around. I have about another week or two to get the entire state application into SAMHSA. So any questions around that, please certainly shoot me an email. If you just don't have the time to work on that, I'm happy to kind of review the one you sent last year and maybe submit that just to get it submitted. But please email me and let me know. As you all know, at this point, we postponed the path monitoring, so we'll revisit that this summer. SAMHSA does still want annual monitoring, but we're hoping maybe we can kind of scale that back, figure out a quicker, easier way to get that done maybe this summer. So stay tuned for that. And then I'll kind of end with some really great news. DEMIS was awarded $2 million for emergency COVID-19 response. We did write into that proposal some system response funds. So we are hoping to add to our mobile crisis teams some experts around homelessness so they could really target the behavioral health, substance use, any kind of resources that we need in the hotels. So we are hoping to get some more mobile crisis staff focused on the homeless system, and also some new 2-on-1 staff positions to help with the response to anybody calling through to get through to the can. And that's all I have. It's 12:01. I went over by a minute. So I don't know if there's any quick questions, but again, please email me. If you're feeling frustrated or you're unsure what to do, I'd rather get the emails and try to work it out, whether we're reaching out to Housing Innovations or CCH or DOH. We're all kind of partners in this together. So please don't hesitate to just send me an email and I'll get it to the right place.
Oh,
All right.
I think you're still muted.
Yes.
No, I thought Andrea was talking. I apologize. I just want to thank everybody for all the information. These meetings, they're really helpful for someone like me who's only been doing this for just over a year now. So I appreciate all the insight, all the information. I always say, and what my company always says, the more tools I have, the better I can service those who need it. So thank you for that.
All right.
Everybody staying
Andrea, I
safe.
think you're muted. Thank you, everyone, for joining us. There's some information in the slides about the next week's meeting, and it's in 2 weeks from now, so May 7th, and we look forward to talking to you guys all then. In the meantime, take good care of yourselves and take good care of each other. All right? Be well.
Thank you guys so much.
Thank you.
Thank you.
Thanks, everyone.